Do oral peptides help with muscle growth? Well, in this video, I'm going to talk to you about my favorite oral peptides for muscle building. I'll talk to you about what works and what doesn't work, and also some of the cool innovations that brilliant pharmacists have come up with so that they can withstand that hostile environment in your stomach. So I'm Regan Archibald. I'm somebody who believes that you can get healthier every year of your life by applying the right inputs. Knowing the right inputs requires testing. And so I'm trained in functional medicine, my entire medical team is, and we found that by understanding what peptides work best based on your blood labs, that's where you can notice enormous leverage when it comes to your health. And so if you want to go deeper, get your blood labs ran, go to agelessfuture.com. My team will take care of you there. Okay, so let's talk about muscle building. Why is muscle important? Well, as we age, our muscle rapidly declines, and the biggest issue that we have is if you lose your power in your muscle, that means your balance won't be there. And then you go and trip and you may fall and break the head of your femur. And then your chances of dying within that year of breaking the head of your femur increase by 50%. So we just want to eliminate risk. Muscle is also really important because it releases myokines. And myokines are these peptides that inform your brain as far as the health of your body and the age of your body. Myokines also inform your cardiovascular network. So you know when you need angiogenesis, where you need new collateral circulation. You know, if we can build muscle, that seems to be like, not only will you enjoy life more because you can do the things you love to do, but you'll also be able to circumvent some of the pain that you have in the future because muscle protects your joints. And one of the primary reasons why people have come into our clinic over 22 years, 70,000 people, is osteoarthritic knees. And so for years, over a decade and a half, we've used regenerative medicine like stem cell therapy, but we're always stacking it with certain peptides that build muscle. So if you're somebody who is noticing that you've got muscle atrophy, you notice you don't maintain your gains in the gym, maybe you have pain, you're looking to support your joints, this video might give you some insights as far as what's available. If you think of these anabolic steroids, a lot of people, when you talk about muscle building, you'll right to anabolic steroids. Even when you talk about peptides, people assume that they're steroids, which they're not. Steroids is a hormone. It's a corticosteroid that is made in your body, cortisol being one of the chief ingredients of those. But these steroids, they are problematic. And so some of these steroids, if you take them for longer periods of time, they can end up creating hepatotoxicity. So it can damage your liver. You can end up with liver tumors, hepatitis. These are well documented. And so one of the things we want to look at is what else can help? Well, SARMs. This is another thing that people lean into when it comes to muscle building. And these are selective androgen receptor modulators. And if you haven't heard of SARMs, they're everywhere. But the idea was elegant. It was like design compounds that activate the androgen receptors in the muscle and bone, but not in the liver. So, you bypass the liver damage that steroids cause. And, they made sure the SARMs aren't doing anything to the prostate or other androgenic tissues. And in theory, all the muscle building benefits with none of the side effects. But unfortunately, most of the SARMs have incomplete data. Some of them have potential cardiovascular risks and significant testosterone suppression. That's the downside. And so this is where you see many of these compounds like SARMs or steroids research chemicals or not for human consumption, even peptides fall into this. If they're not coming from a prescribing medical provider who prescribes through a 503A or 503B licensed pharmacy. So steer clear of those because the goal isn't to build muscle at all costs. The goal is, how can I build muscle now and then make sure that 10 years from now, I haven't compromised or jeopardized anything in my health? And so if you think about what actually works is one of these oral growth hormone secretagogues is called MK-677 butyrate. And this is something that you can be very precise about. It's a non-peptide ghrelin receptor agonist. And so if you have a poor appetite and you need protein synthesis to build muscle, well, how do you get protein synthesis? Two ways only that I know of. One is eat protein. That triggers protein synthesis. The second is to make sure that you're lifting weights. But if you have a hard time lifting and if you don't have an appetite, but you want to build muscle, well, MK-677 has been studied extensively in humans. And the data is pretty compelling on what it does because it mimics ghrelin to stimulate growth hormone release from the pituitary gland, but it does it in a pulsatile way. And it's not flat. So the supraphysiological doses like an injectable growth hormone, they're going to give you a long-term sustained pulse of growth hormone. One reason why we recommend using peptides instead of growth hormone is because when you have that long pulse, you're getting this sensitivity issue with growth hormone and your body won't make it at the right times because you have a gas pedal and a brake in everything in your body. And so what MK-677 does is it doesn't just raise growth hormone, it also elevates your growth hormone releasing hormone. And that decreases somatostatin. So that's the brake on the growth hormone. And then it promotes enhanced growth hormone signaling throughout the axis. And the clinical data is very impressive. They found that there's a 36% increase in IGF-1 versus placebo over just 7 days. So IGF-1 levels reaching like in the 250s by day 3 in studies. But here's the number most people overlook, that if you want to have muscle growth, you're going to need nitrogen balance. And so nitrogen balance is that gold standard and metric for being in an anabolic state. Positive nitrogen balance means your body's retaining more protein than it's breaking down, which is the definition of biological state to build muscle. And in the clinical studies, MK-677 produced a nitrogen balance positive of 0.31 grams per day. The placebo group, negative 1.48 grams per day. Now, that's not a marginal difference. That's a difference between catabolic and anabolic environment. So MK-677, what they found is that in a condition of dietary restriction, it actively reversed the diet-induced nitrogen wasting. So if you're thinking about what that means for older adults, the answer is significant. That means they're going to be building muscle because they have that nitrogen balance. The other peptide that you can think of for muscle building is the body protective compound. BPC-157 is a 15 amino acid peptide discovered in the human gastric juice and is stable in gastric acid for over 24 hours. Very unique among all the peptides, but it naturally occurs there to protect your stomach lining. And it's not anabolic in a way MK-677 is, but what it does is activates the growth hormone. So stacking these two together can be potentially very favorable. But the other thing that it does is it helps accelerate the repair on the tissues that muscle growth depends on. It works through the tendon fibroblasts, and so the tendons become the limiting factor as far as you doing high-intensity training programs, so you can overload a muscle progressively. But if that tendon doesn't keep up, that's when you get injuries and you get tears. So BPC-157 has been phenomenal because you can train hard, but you can also recover faster. The final thing is MK-677, it does raise IGF-1, it does improve nitrogen balance, it supports that pulsatile growth hormone. BPC-157 provides this nice ligament protection and connective tissue repair. But the other thing it does is, you want to think muscle hypertrophy. It involves some different inputs. And so one of the things that we're utilizing when it comes to activating this is an oral exercise mimetic. There's two of them, 5-amino-1-MQ and Sloop 332. Now, these are working on totally different pathways than BPC or even the MK-677, but both orally seem to help improve muscle contractility. They help improve your cardiovascular respiration. They help improve muscle recovery. If you're thinking about how can I optimize my health, well, don't just start throwing these in your body. The very first step is make sure you work with a medical team who understands peptides, they're trained in peptides. They only work through licensed 503A, 503B compounding pharmacies. Your research use only peptides that say not for human consumption, those come from a laboratory where there's no pharmacist. So go to agelessfuture.com, work with my medical team there. I'm Regan Archibald. I'll see you on the next video.